Good day each and everyone. My name is Siti Aina M. Kasan and I'm going to discuss the range of motion. Range of motion is the extent of movement of a joint measured in degrees of a circle. It is the joint movement or active, passive, or a combination of both carried out to assess, preserve, or increase the arc of joint motion. So, yes, the range of motion of a joint refers to how much it can move or stretch. Knowing your range of motion can assist you in preventing injuries. Age, sex, injuries, and arthritis are among factors that might affect a range of motion. So, when it comes to body joints, most individuals thinks about their knees. You have numerous more joints, some of which you may be unaware of. Anywhere in your body where your bones, tendons, ligaments, cartilage, and muscles connect are called joints. Most joints allow for a certain amount of a movement in one or more directions. Physical therapists use a device called a goniometer to measure your range of motion. So, these are the joint movements: the extension, flexion, abduction, and adduction. Extension is to strengthening a joint. So, when you strengthen your knee or elbow, for example, you increase the angle between the bones at these joints. So, flexion is bending a joint. When you bend your knee or elbow, you decrease the angle of the bones at these joints. Abduction, movement away from the center of your body. So a good example of abduction is doing jumping jacks or lifting your arm or leg to get dressed. So adduction, movement back to the center of the body. Example of the adduction is returning your arm to your side after waving or standing with your legs together. So, these are the normal ranges of motion by joint that are generally accepted values for a normal range of motion for some individual joints as measured in degrees. Your range of motion will be measured and recorded by your physical therapist or exercise physiologist. Then they will compare it to the joint's conventional range of motion value. They will inquire about your age throughout your medical history. Depending on your age, different ranges of motion are required. So, the joint movement of the hip are the flexion, that is 0 degrees to 100 degrees, and backward extension, that is 0 degrees to 30 degrees. Foot and inversion 0 degrees to 30 degrees, inversion 0 degrees to 20 degrees. Metatarsophalangeal joint of the foot, flexion 0 degrees to 30 degrees, and extension 0 degrees to 80 degrees. Interphalangeal joint of the toes, flexion 0 degrees to 50 degrees, and extension 50 degrees to 0 degrees. Shoulder that has a joint movement of flexion, that is 0 degrees to 50 degrees, extension 0 degrees to 150 degrees, abduction 0 degrees to 150 degrees, adduction 30 degrees to 0 degrees, lateral rotation 0 degrees to 90 degrees, and medial rotation is 0 degrees to 90 degrees. So the joint movement of the elbows are flexion, that is 0 degrees to 150 degrees, pronation 0 degrees to 80 degrees, supination 0 degrees to 80 degrees. And then the interphalangeal distal or DIP joint of the finger, the flexion 0 degrees to 80 degrees and extension 80 degrees to 0 degrees. Joint movement of metacarpophalangeal joint of the thumb, the abduction, that is 0 degrees to 50 degrees, adduction 40 degrees to 0 degrees, flexion 0 degrees to 60 degrees, and extension 60 degrees to 0 degrees. The wrist flexion 0 degrees to 60 degrees, extension 0 degrees to 60 degrees, abduction 0 degrees to 20 degrees, and adduction 0 degrees to 30 degrees. Joint movement of metacarpophalangeal or MCP, abduction, that is 0 degrees to 25 degrees, adduction 20 degrees to 0 degrees, flexion 0 degrees to 80 degrees, and extension 0 degrees to 30 degrees. The interphalangeal joint of the thumb, flexion 0 degrees to 80 degrees, and extension 90 degrees to 0 degrees. So these are the three types of range of motion exercises. The first is the active range of motion. So you perform these exercises without assistance to improve your range of motion or to prevent other problems from occurring. The second one is the active assistive range of motion. You do these exercises with your therapist's help. This form is for when your muscles are too weak to complete the full range of motion or it's too painful for you. And the last one is the passive range of motion. You don't do anything at all. Your therapist or a machine moves your joint and stretches the muscles. This kind of exercises usually occurs during the first stages of recovery after a procedure. So if you have limited range of motion, your exercises would be designed to increase your file over time gradually. That's all po. Thank you.